First, let me say that you beautifully put together a what can be tricky or complicated topic between reliability and validity, which we commonly hear throughout our program and our courses of study. One of the things that I am personally starting to consider more and trying to kind of put together all of these pieces. For some reason, the name of the class that I took last semester is leaving me, but it was basically focused on assessments. That might have been the name of the class, I don't know. But anyway, when we talk so much about things being reliable and valid, where my eyes are starting to open is to the fact that, you know, a measurement, a test may be a construct to some degree, may be reliable and valid, but we have to be so careful with making sure that we understand the normative sample that it's valid for. And so I know even for me that that's a piece as I've gone through and looked at different assessments. I have not always paid as much attention to, what do I know about this assessment and this measure other than it may be one of the more common measures that's out there, especially if I'm working with someone that doesn't fit that really small sample population that is often used in data. So if we're talking about just as a field, the data that we interpret and collect and even the samples that are representative of a larger population still lack in a lot of areas around gender identity, around culture, race, and ethnicity. And so putting those pieces together and recognizing kind of where we are, where we've always been, really asking myself that question: reliable, valid, but who is the normative sample that this reliability and validity has been shown to be effective for? And then being able to ask ourselves, because how is that impacting the patients that we work with? If I'm using an assessment measure that still may be good in its own right, but actually doesn't have good empirical data on the type of individual that I'm working with, does that do them a disservice in any way? And are there other options out there? So that's an area that I'm really challenging myself in, and it made me think about it when you talked about ensuring validity and making sure that the instruments that we use give good quality. So thank you for stirring those thoughts in me, and I really appreciate your post.